Hi, my name is Brooklyn Darty, and today I'll be talking about a serious and often overlooked respiratory infection called Klebsiella pneumonia. This disease primarily affects hospitalized patients and has become a growing concern because of its resistance to antibiotics. In this presentation, I'll explain what Klebsiella pneumonia is, the causative organism, how it spreads, who's most at risk, what symptoms to look out for, how it's treated, and most importantly, how we can prevent it. Let's begin by looking at the bacterium that causes this infection. Klebsiella pneumonia is caused by a bacterium called Klebsiella pneumoniae. This organism is a gram-negative, rod-shaped bacterium that has a thick, slimy polysaccharide capsule. This capsule helps it avoid being destroyed by the body's immune system, making it especially dangerous and harder to kill. Klebsiella pneumonia is usually harmless when it's living in our intestines. It's naturally found in soil and human intestines. However, when it enters the lungs, often through aspiration, it can cause a severe and fast-moving pneumonia. Klebsiella pneumoniae is part of the Enterobacteriaceae family, which includes other bacteria like E. coli and Salmonella. Now let's take a closer look at how the bacteria spreads and who is most at risk for this infection. Klebsiella pneumonia is not airborne like some other types of pneumonia. It is typically spread in hospitals through contact, not droplets like the flu. The bacteria can be transferred by contaminated hands of healthcare workers or through improperly sterilized medical equipment such as ventilators or catheters. It often enters the lungs through aspiration, especially in patients who are sedated, lying down for long periods, or receiving mechanical ventilation. Because of this, Klebsiella pneumonia is considered a hospital-acquired infection or nosocomial pneumonia. Now, who's at risk? Patients in the ICU, people on ventilators, older adults, and those in long-term care facilities. Individuals with chronic illnesses like diabetes or COPD, patients with weakened immune systems, such as those undergoing chemotherapy or transplants. And also, I thought this was interesting, people with alcohol dependency are also high risk for this because alcohol damages lung defenses. In short, it affects people whose bodies are already vulnerable, making the spread of this bacterium especially dangerous in a healthcare setting. So, what happens when someone does get infected? Let's review the symptoms. Klebsiella pneumonia, like I said before, usually comes on fast and hard. The most classic symptom is a productive cough that brings up thick, sticky mucus, often described as currant jelly sputum. Currant jelly sputum is a dark reddish-brown sputum caused by mixing blood with mucus. Other symptoms include high fever, chills, shortness of breath, chest pain, and severe fatigue. In some cases, if the infection isn't treated quickly, it can lead to abscesses, pleural effusion, or even sepsis, which can be fatal. One of the characteristics of Klebsiella pneumonia is that if you get it, you are likely to have permanent lung scarring and lung damage. So, with symptoms that severe, fast and effective treatment is critical, but unfortunately, it's not always that easy. Treatment of Klebsiella pneumonia has become more challenging in recent years due to antibiotic resistance. Many strains of Klebsiella pneumoniae have become resistant to multiple antibiotics, including carbapenems, which are usually considered drugs of last resort. These resistant strains are often referred to as carbapenem-resistant Klebsiella pneumoniae, or CRKP. To treat this infection, doctors rely on antibiotic susceptibility testing to figure out what will still work. Some options include tigecycline, polymyxins like colistin, or aminoglycosides, but even these may not always be effective. In some cases, a combination of antibiotics are used and new drug options are being researched. Still, the best treatment is really prevention. Once a patient is suspected of having Klebsiella pneumonia, quick diagnosis is essential. Let's talk about how it's confirmed. Doctors diagnose Klebsiella pneumonia using a combination of chest x-rays, sputum cultures, and blood tests. A chest x-ray may show fluid or inflammations in the lungs. If you see here on the left picture is a x-ray of normal lungs, and then the x-ray on the right is someone with Klebsiella pneumonia. The sputum culture helps confirm that Klebsiella pneumoniae is present and determines which antibiotics it may be resistant to. If the infection has spread, blood tests can detect sepsis or other systemic issues. Early and accurate diagnosis improves the chances of a full recovery and reduces the spread of resistant strains in healthcare facilities. Now let's talk about how we can prevent this dangerous infection from spreading. Preventing Klebsiella pneumonia relies heavily on infection control practices in healthcare settings. These include strict hand hygiene by healthcare staff. It's always stressed in nursing school, hand hygiene, hand hygiene, hand hygiene. Proper sterilization of medical equipment, using PPE when necessary, isolating infected patients, monitoring and limiting use of invasive devices like ventilators and catheters and that kind of thing. Hospitals should also promote antibiotic stewardship, which means using antibiotics only when necessary to avoid resistance. Now let's summarize everything we've talked about. Klebsiella pneumonia is a dangerous form of bacterial pneumonia that primarily affects patients in hospitals. It spreads through contact, especially in people with weakened immune systems, and causes severe symptoms like bloody sputum and high fever. Because it is often resistant to multiple antibiotics, it is very hard to treat. Prevention through hygiene, isolation, and proper equipment use is our best defense. Thank you for listening, and I hope you now have a clearer understanding of this serious and preventable infection. Here's my reference list. Thank you.